بسم الله الرحمن الرحيم.
The supraperiosteal infiltration is the most common technique for local anesthesia of individual teeth and may be used to provide complete relief from a toothache. Position the patient sitting upright in a dental chair or stretcher so that the occiput is firmly supported and the body of the mandible is parallel to the floor when the mouth is open. Dry the buccal mucosa around the tooth with a piece of gauze and then apply a topical anesthetic such as benzocaine. Next, grasp the lip with a piece of gauze and pull it outward to delineate the mucobuccal fold. Insert a 25 gauge needle through the fold with the bevel of the needle facing the tooth and slowly advance it along the long axis of the tooth. Aspirate to exclude intravascular needle placement and then slowly inject 1 to 2 milliliters of local anesthetic at the apex of the involved tooth. It is helpful to place a finger against the outer aspect of the lip overlying the injection site and apply firm and steady pressure against the lip while slowly injecting the local anesthetic into the supraperiosteal site. If anesthesia is unsuccessful, one may also inject the palatal site. It may take 5 to 10 minutes to achieve full anesthesia with this technique, and the procedure may not be as effective for the posterior molars. The posterior superior alveolar nerve is a division of the second branch of the trigeminal nerve. The nerve courses down the posterior surface of the maxilla and supplies the roots of the molar teeth. A posterior superior alveolar nerve block provides anesthesia to the maxillary molar teeth. On occasion, the maxillary first molar may not be completely anesthetized by this technique alone, and may require an additional supraperiosteal or middle superior alveolar nerve block. To perform the block, position the patient sitting upright in a dental chair or stretcher so that the occiput is firmly supported. Needle entry occurs in the mucosal reflection just distal to the distal buccal root of the upper second molar. Dry the buccal mucosa around the area with a piece of gauze, and then apply a topical anesthetic such as benzocaine. Insert a 3.5 centimeter, 25 gauge needle through the buccal mucosa and direct it toward the maxillary tuberosity in an upward, backward, and inward direction. Guide the needle to a depth of approximately 2 to 2.5 centimeters. Upon reaching this depth, aspirate to exclude intravascular placement and then inject 2 to 3 milliliters of anesthetic. Be sure to aspirate before injection to avoid accidental injection into the pterygoid plexus with subsequent hematoma formation. The middle superior alveolar nerve is a division of the second branch of the trigeminal nerve. The nerve courses down the outer wall of the maxillary sinus and innervates the first and second premolar teeth and the mesiobuccal root of the maxillary first molar. To perform the block, position the patient sitting upright in a dental chair or stretcher so that the occiput is firmly supported. Needle entry occurs in the mucosal reflection between the second premolar and first molar teeth. Dry the buccal mucosa around the area with a piece of gauze and then apply a topical anesthetic such as benzocaine. Position the patient's mouth half open with a jaw swung toward you and use a piece of gauze to retract the cheek laterally. Insert a 3.5 centimeter, 25 gauge needle through the buccal mucosa between the second premolar and the first molar and direct it in a 45-degree angle. Aspirate to exclude intravascular placement and then inject 2 to 3 milliliters of anesthetic. The anterior superior alveolar nerve is also a division of the second branch of the fifth cranial nerve. It descends down the anterior wall of the maxilla and provides sensory innervation to the ipsilateral, maxillary central, lateral, and cuspid teeth. Position the patient sitting upright in a dental chair or stretcher so that the occiput is firmly supported. Needle entry occurs in the mucosal reflection at the apex of the canine tooth. Dry the buccal mucosa around the area with a piece of gauze, and then apply a topical anesthetic such as benzocaine. Instruct the patient to close the jaw slightly to relax the upper lip. Use a piece of gauze to retract the lip anteriorly. Insert a 3.5 centimeter 25 gauge needle in the mucosal reflection at the apex of the canine tooth. Advance the needle superiorly at a 45-degree angle. Aspirate to exclude intravascular placement, and then inject 2 to 3 milliliters of anesthetic. Massage the area for 10 to 15 seconds to hasten the onset of anesthesia. The inferior alveolar nerve is a division of the third branch of the trigeminal nerve. The nerve descends to enter the mandibular canal, where it is accompanied by the inferior alveolar artery and vein. Distally, the nerve divides into the incisive branch and the mental branch at the mental foramen. The inferior alveolar nerve block provides anesthesia to all of the ipsilateral teeth and desensitizes the lower lip and the chin via a block of the mental nerve. This technique is primarily useful for anesthetizing patients who have sustained severe dental alveolar trauma. Additional indications include post-extraction pain, dry socket, pulpitis, and periapical abscess. Position the patient sitting upright in a dental chair or stretcher so that the occiput is firmly supported. Stand on the side opposite the one being injected. Palpate the retromolar fossa with the index finger or thumb. Identify the greatest depth of the anterior border of the ramus of the mandible, the coronoid notch. With your thumb in the mouth and your index finger placed externally behind the ramus, retract the tissues toward the buccal or cheek side and visualize the pterygomandibular triangle. Anesthetize this area with a topical anesthetic such as benzocaine. Hold the syringe parallel to the occlusal surfaces of the teeth and angle it so that the barrel lies between the first and second premolars on the opposite side of the mandible. Achieving the proper angle is important to the success of this block. Insert the needle in the pterygomandibular triangle 1 centimeter above the occlusal surface of the molars. Note the feeling that the needle makes as it passes through the ligaments and the muscles covering the internal surface of the mandible. Stop when the needle has reached bone, which signifies contact with the posterior wall of the mandibular sulcus. Failure to feel bone as the needle is advanced generally results from directing the needle too far posteriorly toward the parotid gland, rather than toward the inner aspect of the mandible. Injecting into the parotid gland can result in anesthesia of the facial nerve. After reaching the bone, withdraw the needle slightly and aspirate to exclude intravascular placement. Then, slowly inject approximately 1 to 2 milliliters of anesthetic solution. 3 to 4 milliliters of anesthetic may be required if needle positioning is suboptimal. Shortly following a successful injection, the patient will report tingling in the lower lip. However, it usually requires 3 to 5 minutes to achieve complete anesthesia.